Okay, good afternoon, everybody. Welcome to our survey or to our webinar on COVID SEP and how this SEP period is different than prior SEP periods. We like to refer to this as ACA 8.5. My name is Roberta Carlin. I am the Executive Director of the American Association on Health and Disability. And again, I'd like to welcome you all to this very important webinar. We are doing so many surveys now, so I apologize. The mission of AHD is to promote health and wellness for people with disabilities. And we do this in various ways. We work to reduce health disparities. We advocate for full community inclusion. We advocate to promote full accessibility. And we are always at the table attempting to integrate disability into the overall public health agenda. We also work to advance knowledge translation and disability research. Our members are composed of public health professionals, disability researchers, people with disabilities, advocates, caregivers, and healthcare professionals. We have a professional journal, which is the Disability and Health Journal, which you can find the information about that on our website. For the last 8 years, AHD has been very involved in the ACA, and we've worked very hard to reach out to the disability community to encourage people to be more informed about the ACA. This originally started with a project with the Robert Wood Johnson Foundation, where we worked with 10 national partners to develop and create and establish the National Disability Navigator Resource Collaborative. That project moved into a project that's currently funded by Community Catalyst. And with both of those projects, our goal was really to conduct the outreach, to reach persons with disabilities, to educate enrollment specialists, educate people with disabilities, to ensure that they receive the best quality information when selecting healthcare plans. So today, we're going to be talking about SEP, the Special Enrollment Period, and which was originally for 3 months, and now President Biden extended that for an additional 3 months, which will go into August. So we're excited about that, as it will give more people the opportunity to sign up for the ACA. So before I turn it over to Carl Cooper, I just want to let you know that if you have any questions, please place those in the Q&A section. And thank you for joining us, and we hope you enjoy the webinar. We will be recording this webinar, and that is it. So enjoy and thank you. Carl?
Thank you very much. As Roberta mentioned, we've been doing work in the ACA for a number of years now. I've actually been at AHD since 2013, when that ACA project Roberta referred to, the National Disability Navigator Resource Collaborative, or NDNRC, was established. And that's when I joined AHD to help run that program. So I've been involved with our ACA enrollment work ever since the program started in 2013. And it's been sort of one of those things I've really enjoyed working on, is things related to the ACA and health insurance enrollment for people with disabilities. Currently, I serve as the Director of Public Health Programs for AHD, and I am also a person with a disability myself, as well as Anthony Oberg, who's also from our staff, who's helping assist on the program today. He will be monitoring the chat and Q&A, so if you have those, please go ahead and put any questions into the Q&A, and we'll stop periodically to answer those questions. But I wanted to start off first with, as we talk about what the special enrollment period is, it might be helpful for us to take a step back and look at some of the basics of ACA enrollment and what it is. So starting first with the whole idea of what the ACA is. And the ACA was designed to address the problem in the country of the number of people that were uninsured, did not have insurance. Unfortunately, we know that the vast majority of people in this country get their insurance through their employers. I shouldn't say unfortunately necessarily, because usually it's good coverage that they had through employers, but that does create a disparity then for folks who either do not have full-time work or are in jobs where they do not provide it. And as a result, there were a large number of people prior to the ACA that did not have insurance. And the graph that you see on the screen right now just essentially highlights why that's a problem. It shows 3 graph bars. The one that's to the far left is people that did not have insurance for the entire year. The one all the way to the right is people that were insured for the entire year. And the one in the middle is people that had a mixture of times where they were insured and weren't insured. So as you can see, the dark blue bar is where indirect payment sources came from. So in other words, it was uncompensated care. It was care. It was basically when people went to get treated and they were unable to pay for it. And that amount is obviously a lot higher for the group of folks that were fully uninsured. And this is an average per person, by the way. This graph was for 2013, so the year before the ACA went into full effect. So you can see that there were a large number of people, over 40 million people, that were uninsured at the time the ACA went into a full effect, that ultimately were essentially getting care that wasn't always being compensated for. And many times it wasn't, many times the issue was that they were holding off on care because they couldn't afford it. And then they would go when things were far too far along with their medical condition, or they would go to the emergency room and those types of things to address that care. So that was what the ACA was meant to do. So what did the ACA essentially do? Some of the basics are: it requires everyone to have health insurance, which is referred to as the individual mandate. It establishes the health insurance marketplaces in every state, or the exchanges, where you can actually go and buy insurance. So in many states, that's healthcare.gov. In states with their own marketplace, it's something else, but healthcare.gov will direct you there when you say that you live in a state with a state-based marketplace. It also provides tax credits to help pay for premiums. So anyone that is within 100 to 400% of the federal poverty level, they can access these tax credits, and ultimately it helps pay for those premiums. And there's a check that the IRS sends to the health insurance companies every month to help offset the cost of your health insurance premium. And states originally were required to provide Medicaid to those under 100% of the federal poverty level. There was a Supreme Court case that said that the federal government couldn't mandate the states do that, but states are allowed to do it on an optional basis. And I'll get into a little more detail of how that's played out a little bit later in the presentation. The other things that, in terms of what the ACA means for people with disabilities, the ACA was a big deal for people with disabilities as it relates to health insurance. It meant that people were not allowed to, health insurance companies were not allowed to deny you coverage because of a pre-existing condition or disability. It meant they couldn't cancel coverage because you had a serious medical condition. It meant that they weren't allowed to set your premiums based on your disability or chronic condition. What's referred to as, underwriting. When they underwrite you based on your medical conditions, they could charge you more because you had a disability prior to the ACA. They're no longer allowed to do that anymore. There's no lifetime monetary cap, so they can't say that after a certain point you're on your own and we're not going to pay anymore. It covers 10 essential health benefits, which I won't get into a lot of detail right now. But essentially what it does is the 10 essential health benefits cover a lot of the things that people with disabilities care about. It includes prescription meds, it includes doctor appointments, it includes rehabilitation therapy, it includes durable medical equipment, it includes mental health treatment. A lot of the things that people with disabilities rely on are in those 10 essential health benefits. Now, it also created some Medicaid reforms, which once again, I won't get into a lot of detail on this. The main thing you need to know about these programs that are listed on the slide is that they really enhanced the money that went to states to help them do what's referred to as home and community-based services. So the people with disabilities that want to stay in their home and still get the care that they need are able to stay in their home and receive services at home and not have to go into a skilled nursing facility to receive those. That Medicaid can pay for those services in the home, and it allows for a lot more of that. So that's what a lot of the ACA did. So that's sort of the basics of what the ACA did when it was passed. And one of the things that was built into it was an open enrollment period that would happen every year, but also allow for SEPs or SEPs, special enrollment periods. So these are two different times when you can enroll in coverage. Open enrollment is a limited time every year in the fall. It's changed depending on the administration and what dates they set. Early on, when the ACA first went into effect, the Obama administration had made the timeline a lot longer. And then over the time, they had shortened it to reflect the fact that it wasn't new anymore and people sort of knew what to expect. Starting with the Trump administration, it became 45 days from November 1st to December 15th every fall, and that's been fairly consistent now for the last several years, and open enrollment has been for those 45 days every fall. So you can sign up for health insurance during that, and that would be for the following year. So when you're doing the open enrollment for 2020, it would have been for the 2021 year. So you would have been signing up in November and the first half of December for a plan that would have started January 1st. Special enrollment periods are allotted times that people are provided when they can enroll in a health insurance plan that's outside of the typical open enrollment period. And these are for a lot of different things. And there's things that come up that give reasons for special enrollment periods. And the SEPs have to be based on what's referred to as a qualifying life event. So what are the qualifying life events that you can get for a typical special enrollment period? And I'll get into how the current special enrollment period we're in is very different in a moment. But for now, let's take a look at what these special enrollment periods usually are. They usually are for one of these qualifying events that you see on the screen right now. So it's for loss of coverage because you lost your job or for some other reason that you lost coverage. It involves a change in income. It involves a move if you've moved, even if it just moved within the state. If you're in a different area of the state, there could be different coverage options that are available in one part of the state versus another part of the state. There might be different health insurance companies that cover certain parts of the state that don't cover other parts, so that can trigger an SEP. SEP is also if you've had a change in your immigration status, if you get married, if you get divorced, if you have the birth of a child or you adopt a child, any of those trigger a special enrollment period. And if you turn 26 and age off of your parents' plan, that also triggers a SEP. All of these SEPs that I mentioned run from 60 days from the time of the qualifying event. So for instance, if you do get married, you've got 2 months after you get married to essentially have that SEP open to you where you can go in, make changes to your health insurance enrollment, and go ahead and get reevaluated for premium tax credits and look at your healthcare options and make a decision as to what you want to do. So these are all the typical SEPs. And when you are trying to enroll on the healthcare marketplace, because of one of these SEPs, you have to show that you're entitled to it. You've got to give them documentation that shows that you were married, that shows that you had a birth of a child, or that you lost your coverage because you lost your job. Whatever it is, whatever that triggering event is, you've got to be able to show them with documentation that that has happened and you are entitled to the SEP. And that's where we get into the difference between a traditional SEP and the current COVID SEP, because they are very different. The traditional SEP, who is it for? A traditional one is for anyone who's had a qualifying life event, any of those events that I mentioned on the slide before. The COVID SEP is available to anyone without coverage. So as long as you're not covered under health insurance, by health insurance, whether it's you lost health insurance because you lost a job, whether or for any other reason, you just lost your coverage, or you don't have coverage because you never had coverage, anyone can apply for coverage during the COVID SEP. What is a traditional SEP? It's a limited time to address some change. What is the COVID SEP? As Roberta mentioned earlier, it's essentially open enrollment 8.5. And we say 8.5 because this past fall was the 8th open enrollment period that we had. So the 9th one will be this coming fall. So what we are in right now is sort of 8.5. It's that one in between the open enrollment that we traditionally had in the fall last year and the open enrollment that we'll traditionally have in the fall this coming year. So it sort of falls in between that. So we've been referring to it as open enrollment 8.5. When does it occur? A traditional SEP, like I said, is 60 days from the qualifying event. When does the COVID SEP occur? It's started February 15th, was originally scheduled to go through May 15th, but as Roberta mentioned yesterday, President Biden and HHS announced that it was going to get extended for another 3 months to August 15th. So essentially, it's going to run for 6 months. You'll have the opportunity to get enrolled under the COVID SEP. No questions asked. Just go to healthcare.gov and just go ahead and start your application, and you can get enrolled during the COVID SEP. Where do you go? You go to healthcare.gov for either one. If you're at a state-based marketplace, you can go to healthcare.gov. It asks you early on what state you live in. If you select a state that is a state-based marketplace, and I'll get to those in a second in a little more detail, but you go to any of those states, it will then, excuse me, if you live in any of those states, it will then, healthcare.gov will direct you to the website for that state-based marketplace. And why do you have the SEPs? Well, for a traditional one, it's to address a change in circumstances. For COVID, it's to address the uncertainty caused by COVID-19. COVID-19 obviously has upended a lot when it comes to healthcare, healthcare delivery, healthcare financing, all of those things. So as a result, COVID SEP is meant to address some of the uncertainty that's been caused by that, and it allows people to get coverage. Maybe they were healthy people before, and now they're worried they might get COVID. Maybe they do get COVID, and they feel like they need to make sure they get coverage. They can do that at any time now. So as I mentioned, this COVID SEP is for states on the federal exchange that do not have their own state-based marketplace. So the question then becomes, is the COVID SEP available in my state? Well, this map that is on this slide shows all the different state-based marketplaces. And essentially what you need to know is that the COVID SEP applies to states that are using healthcare.gov for their enrollment platform. That would be states that are in the light blue and also in the dark blue. The dark blue ones are state-based marketplaces that use the federal platform. So if your state is one of the light blue states or one of the darkest blue states, then this COVID SEP applies to you, and you can get it from February 15th to August 15th. If you are in one of those medium blue states, then it's a little more complicated. I can tell you this with absolute certainty: every state currently has the COVID SEP in place. However, if you're in one of the medium blue states, then there is, those states have all started their own COVID SEP, but the date that it ends might be different. In fact, as of when I checked this morning, they all were still different because none of them had extended it to August 15th yet. Many of them were still on the May 15th deadline. It's very possible that some of these states will follow the federal government and extend their deadline to August 15th as well. That's something that we're going to be monitoring. And if you receive our weekly newsletters that come out on Fridays that I write, I generally am referring to what the state-based marketplaces are doing. There's a blog post on our NDNRC website that specifically looks at what the state-based marketplace deadlines are. And we've been updating that as that has changed, so you can look at that. So all the states currently have a COVID SEP, but you would want to check to make sure what the deadline is in your state if you're in one of those medium blue states. So let's take a step back now. Let's assume that you want to enroll in a plan and you want to decide exactly what it is, what kind of a plan you should enroll in. So that's what we want to take a look at now. What are some tips for picking a health plan when you do go to the marketplace? And there are a few items you want to consider. For instance, the provider network. Is the doctor that you go to regularly in that health insurance plan's network? What about non-physician providers? Is there other providers like a therapist that you see? Or if you use DME, is the DME supplier that you use included in that network? Those are all things that you're going to want to look at to make sure that this plan is going to meet your needs. There's also, if you take regular prescription drugs, you're going to want to see how any of those prescription meds are, how they're treated by the health insurance plan. I'll get into a little bit more detail on that in just a moment. Are there any limitations on services? If you go for physical therapy or other types of therapy, is there a limited number of visits that you're allowed to go to? All of those things are things that you're going to want to look at when you're looking at various plans. And then there's also, in the ACA, there's what they refer to as metal levels. So you'll see when you go on the health insurance marketplace that there are 4 levels. They are the bronze, silver, gold, and platinum levels. The higher that it is on that list, the more expensive the premium is. But as you go up the ladder, so to speak, in terms of the level of coverage you get, your out-of-pocket expenses go down. So your premiums go up, your out-of-pocket costs go down when that happens. So if you're someone that doesn't go to the doctor much, you don't have a prescription med, or you only have maybe one that's not that expensive, you might be able to get away with a bronze or silver plan. But if you're someone that does utilize a lot of healthcare and you do end up needing you do end up needing healthcare delivery on a regular basis, then it is going to be something you're going to want to make sure that you're taking into account and really deciding if you're looking at that dollar figure that's on the healthcare.gov website and that premium looks cheap, just factor in how much more it's going to cost you then on an ongoing basis, because that will affect how much you're ultimately paying for your healthcare. And sometimes paying a little more a month in your premium will save you a lot more money down the road when you're going to actually utilize your insurance and go to see a provider. And I realized before I got into this, I did not stop to see if there was any questions. So Anthony, do we have any questions that were from the first part of the presentation?
I do not see any in the Q&A box, nor in the chat.
Okay. Just a reminder, if you have any questions as we're going through this, please feel free to go ahead and put them in either the Q&A or chat. Anthony will continue to monitor those, and we can get to those when it's the right time. So let's go ahead and talk a little bit more in a little more detail about some of the things you need to be thinking about when you're looking at health insurance plans and comparing them. I like to refer to it as health insurance Jeopardy. And when I say that, for anyone who's familiar with the game show of Jeopardy, you'll know that in Jeopardy, it's not about the answer, it's about asking the right questions. So when you're in the Jeopardy game, you have to phrase your answers in the form of a question. And really, when you're talking about health insurance, you need to make sure you're asking the right questions, because if you're not asking the right questions, you could end up in the wrong health insurance plan. We have a whole series of these that we've done over the years in terms of these health insurance Jeopardies. I'm not going to take the time to go through all of these, but there are a few things that we want to highlight. And so we'll go ahead and go through some of these questions that I think will sort of some of what we're talking about. So for instance, we've got all the different categories here, and let's take at least a sampling of some of the questions in each of these categories. So for prescription drugs, what happens if you've tried generic drugs before and they were ineffective? Well, in this instance, the question you need to ask is, does the plan require that you try a generic drug first? It's commonly referred to as step therapy. If a health insurance plan requires that you try a generic drug before you go to the name brand drug, then that might not be the right plan for you if you know that that's going to be the case. So in that instance, that might not be the plan that you want to pick. So see if the health insurance plan does require step therapy. For our next one, let's go ahead and take a look at medical devices. For medical devices, you use a motorized wheelchair and your current chair won't keep a charge. Well, in this instance, the question you need to ask is, does the plan cover the repair of DME? Not just acquiring the DME, but actually repairing it. Is that covered in the plan? Because that can become an important thing that you need to be thinking about. Let's go ahead and take a look at some rehab and habilitation questions. In this instance, you use rehabilitation therapy and have to go repeatedly for it to have any lasting effects. Well, as we just talked about, the question you need to ask then is, does the plan put limitations on the number of rehab visits? We talked about that earlier in terms of things to consider. Thinking about, are there limitations on the number of visits? Then that's something that you probably want to think about. Let's look at another rehab and habilitation benefit question. You need coverage for a 4-year-old child who is nonverbal. And this commonly happens, especially with some children that have developmental delays, and they need to have some sort of therapy to help address that. So the question you need to ask here is, does the plan cover speech therapies? And there is an important distinction here. The reason I said a 4-year-old child who is nonverbal is, in a 4-year-old child who is nonverbal, it's because they probably, most likely, were never they were always nonverbal. And they've never developed that form of speech. You compare that with, say, someone who's older and has had a stroke and loses the ability to speak. They might be going to the same provider. They might also be going to a speech therapist and working on speech. But for them, it's going to be a different therapy in terms of how the insurance company is going to look at it. For someone who's trying to relearn how to speak, then it's rehabilitation. For the young child, it's habilitation because they never had the skill. It's a new skill they're trying to learn. And many times, health insurance companies look at these very differently. So it's something you really need to think about if you're in this situation where it's someone who has always, excuse me, I should probably say who's always been nonverbal, then you need to see how the insurance company treats speech therapists, but also how it treats habilitation benefits. Because unfortunately, health insurance companies many times do not like paying for habilitation benefits where they do pay for rehabilitation benefits. So many times there's a real disparity in terms of how the health insurance companies really look at these two things. Let's go ahead and move on to Medicaid eligibility. And the thing I always like to make sure I highlight on this is when you're completing the enrollment on healthcare.gov, you arrive at the question regarding disability. It will ask you about whether you have a disability or not. And in this instance, the question you need to ask yourself is, do you want to apply for Medicaid? If you don't want to apply for Medicaid, if you know, for instance, that you make too much money to qualify for Medicaid, or you've been through the Medicaid application process before and couldn't qualify, then you may want to answer no on this question, even though you do have a disability. The reason that is if you answer yes to this question, it is going to put you into a Medicaid eligibility determination, and it could then make the process take longer for you to get health insurance. If you just answer no on this question because you're not going to qualify for Medicaid, then it will allow you to sort of bypass that and go directly to choosing a health insurance plan. So just a little tip that we like to provide there. Even though as a person with a disability, you might be inclined to answer yes, you may want to answer no to avoid a delay in coverage. The summary of benefits and coverage is a document that tells you what a health insurance plan covers. So let's look at a question that deals with the summary of benefits and coverage. The summary of benefits and coverage, let's look at someone, you have a condition that requires you take a specific drug. And in this instance, does the summary of benefits and coverage say what drugs are covered and what the drug copays are? So for instance, you want to look at the pharmacy design, exactly how it's set up, if there are certain named drugs that are listed there, if your drug's included, and how it's classified. Is it classified as a generic? Is it classified as a name brand? Or is it even classified as a specialty tier? Because most people are aware of tiers when it comes to drugs, but they only think of it as generic versus name brand. There's also another one, a specialty tier, and sometimes there's multiple specialty tiers. And each time you go up a level, it costs a little more in terms of the copay. So that's something you want to look at. You might think, oh yeah, I know I have a name brand drug, so this is going to be my copay on name brand drugs. Well, if your name brand drug is on the specialty tier, then you might even be paying more than what you think is initially listed in the summary of benefits and coverage. Mental health. The question here is, your prior mental health treatment required several therapy sessions a month. And in this instance, the question you need to ask is, does the plan limit the number of visits for mental health therapy? And is this permissible under the Mental Health Parity Act? And in this instance, the Mental Health Parity Act was essentially put in place that says health insurance plans are not allowed to treat mental health treatment any different than they treat regular physical treatment. So for instance, if there is, you're going to see a therapist for mental health treatment, health insurance plans are allowed to limit the number of visits you have with that therapist, but they're not allowed to be more than what they would allow. They're not allowed to, the limit is not allowed to be less, is what I should say. It's not allowed to be less than what you would be allowed to go to, say, for instance, if you were going to physical therapy. So if they are allowing 12 visits under a physical therapy, then they are allowed to limit you to 12 mental health therapy visits. But if that number is lower, then they're technically in violation of the Mental Health Parity Act. So at this point, I'll go ahead and take another break and see if we have any questions before we get into the final part of the presentation, which is how the recent Recovery Act affects the ACA and coverage.
Okay, we have a couple of questions. One is regarding step therapy. Does Medicaid generally require the patient to use generic drugs first? And then the second part is, what if the generic drug has negative side effects?
With Medicaid, that's going to be largely dependent on the state that is running the Medicaid and if it's part of managed care. The managed care company is ultimately going to be the one that determines that. So that's something to just, in terms of many times you don't have options when you're going into Medicaid. If there's a managed care company that's in charge, you're sort of stuck with them generally. And that's one of the things that we've sort of, I want to be careful how I say this. That's been one of the things that we've advocated for, is making sure that managed care companies understand some of these things when they're doing Medicaid managed care, because that does become an issue with some of this stuff. And if they require step therapy, then usually the person with a disability is going to have to jump through some hoops with their provider, explain to the managed care company why that drug doesn't work, that they had negative side effects, and all those kind of stuff. So with Medicaid, it's always a little bit of a different animal, just because the options are limited for the consumer. And frankly, the options could be limited for a consumer in the health insurance marketplace if you only have one insurer that you're dealing with in your area. But it still is something to think about. And there are ways around the step therapy requirements, but sometimes it becomes a lot more hoops that you have to jump through. Any other questions?
Yeah, just one more. Are there resources that can help determine what insurance is best for a specific disability through the SEP?
There are a number of resources that are available to help compare health insurance. We're actually in the process of developing some curriculum that's going to be, we're excited that's going to be available to SIL staff in the near future to help compare that, but that's going to be something that's still down the road, so that's not necessarily going to help you right now. I do know that there are a lot of what they refer to as cost calculators that are out there. So I know, for instance, Kaiser Family Foundation has a cost calculator that you can go and find, where you can input, what the premium would be, what you utilize in costs, and helps you compare, that issue of I was talking about earlier. If you pay a little more in premiums, it can really bring down the cost overall. There are online things like that. So I would look for something that is like a health insurance cost calculator. If you Google something like that, that should give you what you're looking for. In terms of specific disabilities, then no, there's nothing that I'm aware of that would specifically give you an idea of what plan is going to be best. And some of that's going to be because things change so much from year to year. Health insurance companies change, they change their plans, they change what's covered. Sometimes it's state regulations that change what's required to be covered. And there's a lot of things like that. The best I can tell you is, if there is a local disability organization that works specifically with your disability, you might want to look to them to see if there's guidance that they can provide you. And like I said, as a preview of coming attractions, we're in the process of developing that curriculum, which hopefully will really help SIL staff be able to understand these issues better and ultimately be able to provide one-on-one assistance to consumers who have these questions. Any other questions, or did that raise more?
And there is one more. Can one get coverage through Medicaid and ACA?
If you get, let's put it this way, this is probably a better way to answer it, because technically the answer is yes. But the bigger answer is not if you want to get the premium tax credits. If you have Medicaid, then if you have, I should say it this way, if you have any form of health insurance, whether it's Medicaid, Medicare, or employer-based coverage, you cannot get the premium tax credits that are available on the marketplace, which means you'd have to be paying out of pocket for the entire premium, which then many times makes it ineffective from a cost perspective. Other questions?
Are there Jeopardy questions related to COVID-19 treatments and therapeutics? Any related to telehealth?
No, we have not, because we've not updated the health insurance Jeopardy slides since COVID has hit. I will say this, that when it comes to COVID treatment, which is a good question overall, we should really talk about that overall. This is going to vary greatly from state to state, because a lot of this ends up being how states are treating this and how states are regulating their insurance companies on this. I know, for instance, in some states, testing is entirely free. In some instances, It's free if you don't have health insurance, or they require you to provide your health insurance. And then whether your health insurance gets billed, I'm not sure. But it does vary greatly from state to state. So that's something that you should look at from a state perspective, in terms of, how that's being addressed. I know that, vaccines are dealt with very differently state to state. So those are all questions that I think that, like I said, we live in a society where, the federal government has a lot of control over some of this stuff, but the states ultimately implement a lot of this. So there is, as a result, great variety when it comes to how these different states handle it. Any other questions, or should we move on?
There are no more showing up, so I think we can move on.
Okay, well, you can go ahead and still continue to add those questions to the Q&A, or if you have a follow-up from what I answered, feel free to go ahead and add those. But right now we want to take a look at the American Rescue Plan Act and the ACA. The ARPA, as I'll call it, was the American Rescue Plan Act that was signed into law earlier this month by President Biden. It was essentially the COVID-19 relief package that you heard people maybe talking about for the first several months of this year. And what did the ARPA do? These are the basic things that are sort of unrelated to health insurance, but these are the things that you may have heard about in the news. It included stimulus checks for most Americans. It expanded and extended unemployment benefits. It increased housing and actually food assistance as well. And it provides funds for business assistance as well, in form of more funding for the loans that they made to small businesses. The ARPA and the marketplace. It did do a lot as it relates to healthcare.gov and access to health insurance. The first thing that it did is it increased the amount of the premium tax credits. So if you were already enrolled in an ACA an ACA plan, you could be eligible for more tax credits, which would reduce your monthly premiums. And this, they've actually provided some guidance. CMS has provided guidance on this. CMS is the governmental agency that oversees healthcare.gov. CMS has indicated that as of April 1, these higher monthly premiums will be reflected on healthcare.gov. So if you are enrolling in the special enrollment period, starting April 1st, the premium assistance will be reflected on their website. As of right now, if you went on there, it would still be based on the old calculations. So your actual premium tax credit that you would be eligible for is probably actually going to be higher than what it's going to show right now on healthcare.gov. But if you go back after April 1st, you should be able to get coverage. The other thing that the ARPA did for marketplace coverage, I mentioned earlier that tax credits are available to people between 100 to 400% of federal poverty level. So people once you go over that 400%, we refer to them as dropping off the subsidy cliff. It's supposed to go down gradually as you go up in income, but there still was this steep drop off once you hit the 400%. So what the ARPA law does is it does provide additional subsidy assistance to people to phase them out a little easier. So it goes technically right now above the 400% of the federal poverty level, so people do not drop off the cliff. And that's especially helpful for people that have fluctuating income, whether it's because they work an hourly job and as a result, sometimes they're above the 400%, sometimes they're just below it. Well, if that's the case, then you could be getting premium tax credits throughout the year, but then you have to pay them all back when you go and file your tax return the next year. So it's supposed to eliminate this subsidy cliff so that people will not fall off of it and will have a gradual decrease of their subsidies. The other interesting thing about this is these increased tax credits are not going to be just for this year. They're going to go through 2022. So when you're even enrolling, if you're enrolled in an ACA plan now, and you're going back next fall in open enrollment, deciding whether or not you want to make a change or whatever, these tax credits will be in effect for 2022. So they will be reflected in the open enrollment period coming this fall. Moving on, what does ARPA do for Medicaid? It does a couple things. It increases the state's federal medical assistance percentage, or what we refer to as the FMAP. It's the amount of money, for those of you who don't know, Medicaid is funded by both the federal government and the states, and it's run by the states with federal guidance. What the FMAP is it's the amount of money that the federal government puts towards a state's Medicaid program. So what the ARPA did was it provided more money to the states to provide home and community-based services. If you recall, I was talking about home and community-based services earlier as it related to the ACA in general. And HCBS essentially is really important for having people with disabilities being able to receive care in their homes and not have to go into a skilled nursing facility to receive those. This is going to make it easier for states to continue to essentially have those HCBS services available to them and make it so that they do not have to cut those programs, perhaps because they need to make cuts because the economy's down and tax revenue's down. As a result, they've got to make cuts in their state programs. This will make it so that they do not have to do that in the HCBS arena. It also requires coverage of COVID vaccines and treatment for Medicaid beneficiaries. Earlier, we were talking about, how states deal with COVID vaccines and treatment as a whole. For the Medicaid, they are covered. But what it does, the states still do have, discrepancy on how they want to address it for the larger population in their states that aren't on Medicaid. And it also provides additional matching funds to the 12 states who have not expanded Medicaid if they were to expand. You recall earlier when I was talking about the basics of the ACA, I explained that originally the ACA was designed that all states would expand their Medicaid programs to cover anyone who was under the 100% of the federal poverty level. And ultimately, a Supreme Court case said that the federal government couldn't mandate that it was optional for the states. Well, the states that still have not expanded Medicaid is on the next slide. And if you look at this slide, you'll see that all the states that are in dark blue are states that have already expanded their Medicaid programs. States that are in orange have not expanded their Medicaid yet. So these 12 states, if they decided to expand their Medicaid right now, they would get increased money to do so. Essentially, the federal government's dangling another carrot in front of them to try and get them to agree to take the money to expand their Medicaid. This has been something that's been happening ever since the Supreme Court made the determination in 2012 that states would not be required to expand Medicaid. Initially, half the states said they were going to expand, the other half didn't expand, and slowly, those states that didn't expand initially have been expanding it slowly but surely. And eventually, I think eventually all the states will probably expand their Medicaid programs just because their federal dollars are going to all the other states and they're not getting any of the benefit from it. As we get further and further away from when the ACA started and all the politicalization that happened behind it, I think that eventually these states will expand. I like to remind people when we talk about this that the Medicaid program itself was made part of the 1965 Social Security amendments when Medicare and Medicaid were both passed at the same time. So that's when it became eligible to all the states. It took over it was actually more than a decade until all the states had implemented Medicaid programs under that. So just like that, I think it's going to take time, but eventually I think all the states will expand their Medicaid. This is just going to provide a little more incentive for these states to do that. So that's what this is directed towards, those states that you see in orange. If you live in one of those states and you want to get into some advocacy, that's an area where you can talk to your states and say, hey, listen, it's even more advantageous to you. And actually, if the way you do the calculations, some of these states would make money if they expanded Medicaid. It's not just that it wouldn't cost them anything to expand their Medicaid program. It would actually result in a net plus to their Medicaid budget, that they would be getting more money than they would have had they not expanded Medicaid. And then finally, I should say one other thing: the two states that are lined, Oklahoma and Missouri, are in the process. They have adopted Medicaid expansion, but it has not been implemented yet. I think both of them, as of July 1, will be fully expanded, and they will be accepting people to apply for the Medicaid expansion population. So that's, if you live in one of those two states, that'll be something to be looking forward to this summer, is the expanded Medicaid in your states. So those are the states that could expand under this and receive additional federal dollars to do that. In terms of if you're interested in learning more about any of this, I would point you to a couple of websites that we've got. The one is our organizational website at ahd.us, and the other one is the project that Roberta and I both have mentioned, our National Disability Navigator Resource Collaborative. That's where you're going to find a lot of the information that we were talking about earlier as it relates to the health insurance plans, the health insurance Jeopardy, links to the health insurance Jeopardy presentations are all on there. Those are also on our YouTube page, I should say, as well. They're all more geared towards navigators, so people that are assisting others, but the truths are still there in terms of questions you need to be thinking about, but they're worded in a way that it's looking at someone who's assisting a person with a disability, not the person with a disability themselves. But that's what there's a lot of resources on that that are geared specifically for people helping people with disabilities find insurance plans. So that's what that project was for. So there's a lot of resources on there that would address that. And finally, here's our contact information. You can feel free to reach out to us at any time if you have questions. Once again, there's our website address. You can feel free to reach out to me via email is probably the best way, especially as we've been in the virtual environment. I've been working from home for over a year now, so email is absolutely the best way to reach me if you need to. So that's our contact information. But before we wrap for the day, I figure we should open up one more time to see if there are any questions again.
First one we received since we started the presentation again, not a question, but just a follow up on the COVID-19 testing options, and just saying that monoclonal antibody treatment and options to support the setting and supports for those would be helpful, sort of Jeopardy questions that might be added in the future. And then the last question I see here right now is it possible to get the PowerPoint in an email?
Yes, we will. We'll be posting these to our website later this week, and they will hopefully be in our newsletter that will come out Friday. I would encourage you to go to, if you're interested in receiving that newsletter, go to our NDNRC website, and you can sign up for the Friday update that we send out there. You'll also find that all the archived newsletters that we put out on our Friday update are also on that website as well. So you can find those archived, but that should be in our Friday newsletter. And it will hopefully be up on our website by the end of tomorrow. And we did record this webinar too. I should mention that we did record the webinar, so hopefully we'll have the recording up there too. Any other questions?
In the chat, is there a national directory of navigators?
There is a list of the navigators that that CMS has put out. But in terms of if you want to, the easiest way to find local help is to go to healthcare.gov, and there is a find local help option on there. And that would be, if you were trying to find a navigator, that's where I would go. The one thing I would, and I don't want to tell anybody specifically how to find the local help, but one thing I will say is you can filter by different kinds of help. There are brokers that are listed on there and navigators. So if you want a navigator, then you should put that filter on and look for a navigator, and it will filter out the brokers. And the main difference between brokers and navigators, I'll just let you know, is navigators are paid by the federal government to do assistance. Brokers receive their commissions from the health insurance companies. So take from that what you will. Any other questions?
I'm not seeing any at the moment, but we can give it a minute if you want.
Well, if anyone does have questions, I would encourage you to go ahead. You can shoot me an email. Like I said, my email's here on the screen, so feel free to reach out and ask. And if something comes up that you think of after the fact, feel free to reach out, and we can hopefully help you out. Like I said, a lot of this does vary from state to state, so your experience might be different, but ultimately we want to make sure that people are making good decisions on this and are getting into a health plan that's going to work for them. So we thank you for taking some time out of your day to listen to us. And if you don't have health insurance, please go out and make sure you get covered. Thank you.